for that human aspect in your own work. But I do have an experience where working.
Yes. Okay. Thank you for that nice introduction. It's fun to come back and see, so many familiar faces, and exciting to meet the fellow panelists. I'll probably just stand and talk for a few minutes. I'll just probably talk for 5 or 10 minutes and then leave space for them. And I really just kind of want to talk about 3 things. I want to tell you a little bit about my story, about how I started at Utah State and how I ended up here, and looking at people who helped me along that journey, so thank you so much. Then I want to talk a little bit about this notion that an education in the humanities and social sciences can really prepare you to do anything. I never imagined taking English courses, over, I guess I was in the old Merrill Library before it moved over here, but the English department was once housed on the 4th floor over there. Anyway, I never imagined that I would be a physician and end up going to medical school, but that humanities education just overwhelmingly prepared me to do that. And so I just kind of want to talk about how I see the humanities and social sciences fitting into preparation for like the whole wide world. And then kind of lastly, I want to give a couple of notes to, I try and do this every time I talk, to women about career and to men who care about women in their lives about career. And I know there are some advisors here, and so I will also say that if there's any way I can be useful to your students in the future, I'm really happy to, because I have a strong sense of the importance of passing things back. So I'll start with a little bit about my story, the first item. Hi, welcome. So I grew up in Millville. In those years, it was not a suburb of Logan. It was a little kind of farm town. There were more cows than people there when I graduated from high school. I went to Skyview High School, and then I came to Utah State, and I loved language and literature. I loved studying about people. I loved reading what thoughtful, great writers had to say, and I also loved the idea that we all had language at our disposal, and we could use language and literature in the same way to make meaning of ourselves and our lives. Had this great education here, and really was interested in continuing, and I was also interested in leaving Cache Valley. And so I went kind of as far away as you could. I guess Florida would have been a little farther, but I applied and was accepted at New York University to get a master's degree, and so I moved the summer after I graduated from a little apartment in North Logan to Greenwich Village. And anyway, then got a master's degree and a PhD from New York University. And that was just a remarkable, life-changing experience. And it's to the credit of the English department at Utah State that the people that were my friends in graduate school had degrees from Harvard and Princeton, and I was wholly prepared to communicate with them, to talk about them. They knew things about like French feminism and Derrida that I had to scratch my head about, but then once I was introduced to it, I was completely capable of bending my brain around it. I had been very well prepared, and I'm grateful to this institution for that. I finished that degree, and I kind of taught through the process of getting that degree. I moved around the country a little bit, and then I kind of came to this life crisis. My degree was in composition and rhetoric, which means while I loved language and literature, I was like a little more interested in how ordinary people like you and I use language to make sense of themselves and their world. And there weren't very many jobs open in that field when I finished in the 3 or 4 years on either side of me getting my degree. And I had a couple of job offers, but they were in places I wasn't really interested in living or trying to earn tenure. And so I spent 10 years doing this thing I was really passionate about, but felt like I wanted a little more control of my life and wanted to decide what to do. Simultaneously, I had a long-term relationship that ended, and I kind of had this big crisis. And I thought, what am I going to do with myself? And I can remember the day I was like laying in a bay. I was living in Boston at the time. I was actually in Cambridge, Massachusetts. I remember laying on a couch, looking out a bay window, and thought, I think I should go to medical school. Like, it just kind of came to me like that. And then I started thinking about it, and I did. I was teaching college I was teaching English at a place called Bentley College. I quit that job. I moved back to Utah State. I had to do 2 years of pre-med because I had earned this degree, but I didn't have all the sciences accumulated, so I did 2 years of pre-med, one of which I had taught I taught a writing class in the English department while I was simultaneously taking classes the second year, and that was really an interesting experience about learning science while teaching in the humanities. And then I took the MCAT, I was accepted, I went to school at the University of Utah, and then completed an emergency medicine residency at the University of Nebraska at Omaha. And for about 10 years after that, I worked primarily in Evanston, Wyoming, just this wonderful little rural community. I got some student loan reimbursement, which was very useful because it was an underserved community, but it was a wonderful place to be like a baby beginning doctor. It really made me stretch, it made me grow. Sometimes I thought I might like throw up driving to work, but I just learned so much. And those initial jobs are just so powerful for what they teach you. Like I grew hair on my chest and broader shoulders. Anyway, and now I work at, I have 2 small children, and as they got older, it was difficult for me to live in Logan and work in Wyoming. So emergency medicine is a small community in northern Utah. I had stayed in touch with a couple of physicians, and there's a group of physicians who staff Cache Valley Hospital and then Brigham City Community Hospital. And we all share our time equally between those 2 facilities. And so that's where I work now. And it's a great job and a good life. Couple of bullet points, and I'll keep track of myself here. So a couple of stories about you can do anything you want with a degree in humanities or social sciences. When I thought about going back to school, everyone said, "Are you crazy? Like, what do these 2 things have to do with each other?" And to me, it was completely the same experience. Like it was 2 approaches to the experience of being human. Did I want to read and write about it and read what other great things have been said about it, or did I want to be in the middle and the mess of it? And I'd kind of done this and had loved it, but I was ready to, I just really wanted to get my hands dirty and be messy. And I asked for some coaching from a physician, this kind of renowned guy at Tufts University that a friend hooked me up with, and he talked to me in this like kind of fancy office with a big mahogany desk, his 40 years of practicing medicine, and I asked him, I said, well, do you think I'm going to be able to cut the science courses? And he said, Marion, medicine isn't a science. And I said, really? And he said, no. He said, it's an applied humanity. And that little term, kind of says everything, probably, but I think many things are an applied humanity, but medicine is an applied humanity. And I think part of what he was getting at, and part of what I say when, a humanities degree at Utah State prepared me for all kinds of things, is that I had data, right? Like I had the raw data of dead poets and, critical theory and, rhetoric and how to write. But more important than that, I had been taught a way to think. I'd been taught a way to perceive the world. And I'd been taught how to communicate and how to tell stories and how to listen to stories. And all of those things are all I do every day now when I go to work. I'll just tell a brief story to illustrate that. At the end of my 3rd year of residency, the University of Nebraska at Omaha is this big tertiary care center. It's like IMC in Salt Lake City, like the Internet Healthcare Center, or the University of Utah, this big trauma receiving center. And there were 36 rooms, and I wore this phone on my belt, and you just ran from room to room. And when a big trauma came in, the pager, your whole side of your body vibrated, and you left whatever you were doing, and you ran to the trauma bay. And I was the only woman in my class, and there were 6 of us, and the other 5 residents in my class were men, and they were terrific guys. I got to know them really well. I can thank them so much for all of their support. But at the end of, and as we were kind of getting to our last year of residency, we were kind of feeling more confident, and kind of the conventional wisdom about all of us was that the stereotype of emergency medicine is that it's kind of for people who like adrenaline rushes and kind of, anyway, and I don't necessarily fit that stereotype, but that's the stereotype. And some of the guys in the program, the conventional wisdom was the men, we're doing the heavy lifting, we're seeing all the patients, and thank goodness Marion is here, because we just need that softer touch, we just need, this kindness, but, we're doing all the work. And they didn't mean it in a pejorative way. I was happy to be labeled that way, because those are things I value about myself, right? I wanted to be kind to patients. And I'd learned a lot, and I could do things with them. And anyway, probably about 2/3 of the way through the last year, they crunched all the data and all the numbers from the residency, and I had seen the most patients, and I had done the most procedures. and we all kind of scratched our head about that. And I don't tell you that to make myself sound important. I just tell you that because partly to undo some stereotypes that we all have got some practice in undoing, but also because I thought, why? Like, I am a beginner at science, I am a beginner at all of this, how could this be possible? But what I realized is that once again, it was that humanities education that I got so fast, not because I had all this science data in my head, but because I had learned how to listen, and I would enter a patient's room, and I would sit down on the little stool, and they would talk, and I could hear them, and it made me incredibly fast. And I didn't have as much data in the back of my head as other people did, but I knew how to manipulate it better, and I knew how to problem solve it better. So if somebody gave me this list of symptoms, and these complaints, and these tests, like, I could rearrange that faster than anybody I knew to, like, figure out what to do. And that's all because of, Utah State University and somewhat because of NYU. So you can do whatever you want with a degree, in the humanities and social sciences. Finally, and then I'll stop. I just need 2 or 3 more minutes, because I just try and make an effort to say this every time I have a chance to talk to women, or to men and women who love them, or to people who get to advise them. Sometimes there's I think a misunderstanding about women, that if they are interested in parenting, if they're interested in raising their own kids, they think, well, I can't reach for that, it's just too much. Like, it'll get in the way of my other career goals. And I think that, or it will get in the way of my other life goals. And I think that is exactly the opposite way to think about it. And let me give you a couple of examples. And all this is to say that the farther you reach, the more power and the more freedom you'll have. I have a friend who's a rock climber. I can claim to have rock climbed maybe twice. but this friend has this funny saying that they talk about like, if somebody's kind of struggling getting up the hill, and if he's up higher, he'll say, hey, like, the holds are so much easier up here. They're just like just struggle through that. The holds are so much easier up. They're so much easier about here. You'll feel so much more secure when you get up higher. And I just want to say to all of you that as a woman, that's completely true. And I'll give you a couple of bullet points about this. If you're interested in raising your own children, you want to have as much power and as much authority and as much of command as your own time as is possible. And the higher you climb that mountain, the more of all of that you're going to have. You also, if you're interested in spending time with your own children, as a woman or a man, you want to make as much money as you can for every single hour you're away from your children, because it's going to mean you have to spend fewer hours away. And so wanting to make money in that paradigm is not greedy, it's not inappropriately ambitious, it's loving, it's responsible, it's kind. And so if you have a chance to advise a student, or if you are a student and have a chance to think about it, like, you want to gain as much as you can, because then you can be more in charge of your life. And if you're interested in being a parent, you want to be in a place where you can do that. And I just kind of grieve for the young women I see, who say, well, let me take this job or that job because it's easier and I'll be able to raise my family. That's exactly the opposite of what's true. There's certainly a juggle in my life. It's not always easy. I'm currently a single mom. I have a 10-year-old and a 5-year-old. But all of that scrambling, has meant that, I'm currently working about 2/3 time. I can support them. I can take care of them. I'm around for the important things. So don't aim low thinking it's going to make you able to be a parent. You've got to aim really, really high. And I think that's where I'll leave it, but I'm excited to hear from these other women. So, and they've got slides.
Marion's hitting on some topics that I want to hit on too. And speaking truth to power, which is really important. So I'm Kathleen Pitcher Toby. It's a pleasure for me to be here. I'll give you a little bit of my background as well, because I think it's important for you all to understand. I had not a direct line from A to B. I had a very meandering path. And I think it's important for people who are in school right now to understand and to have hope that things are going to work out so you don't panic and stress out. So I'm very proudly have a bachelor's, master's in American history from Utah State. Some of the best years of my life were spent at this beautiful institution that I love so dearly. And then I also have secondary ed certification because I thought I was going to be a teacher. Things did not work out that way. So just to give you some interesting background, and I grew up in Smithfield. I went to Skyview High School, so I'm a local person too. I wrote my master's thesis on the life of this amazing woman. Her name was Grace Mitchell. She converted to Catholicism and became Sister Marion Carrie Mitchell, and I ended up writing her life history from a feminist perspective, and she was just extraordinary. And my daughter is now named Grace because of her. But she was really ahead of her time, I think, a feminist in her own way, a nurse and a teacher at the College of the Holy Names in California. So I went into teaching thinking, you know, I come from a family of teachers. I thought this is going to be my calling. And I want to help kids. And I had this vision in my head that I was going to impart this wonderful knowledge about history to these welcoming students. And I had sort of this idyllic image, I think, in my head of what the experience would be like. And I did my student teaching in history at Mountain Crest High School. And this was more of my experience. I was like, I went into it, you know, rose-colored glasses, I think, started in my eyes about the impact it was going to make. And it didn't matter if it wasn't going to make me money. I was going to help these kids. And it just ended, it was just not for me. Let's just put it that way. And it's for those of you that want to go into teaching, I say, amen, love you, please do it, because it's one of the most important professions around. But it was not for me. I just did not have the patience to handle it. So quickly, you know, I finished my secondary ed certification now. It's done, in case I needed it, and completed my master's degree. And then I'd always had an interest too, as well as in history, just a love for history, also a love for politics. So I had an internship in poli-sci, worked for Senator Hatch, and I worked for him as an intern in Salt Lake and Washington, and then after I finished my master's degree, I went back and worked as a legislative assistant in the Senate. And it's funny to reflect back on it now because it was so less partisan. Oh my heavens above. I mean, I think it was really a different place. And Hatch worked with Kennedy, and all kinds of cool healthcare reform things were going on at the time. But I think a much less toxic atmosphere and a great experience for me. Then I ended up, I was super homesick, and I too had a broken heart, and decided I missed being in Utah and missed the mountains, so I came back and worked as an event director and then as an executive director of special projects for Governor Mike Levin. And what that meant is I was using my writing, which I'll talk about in a minute, to my writing skills, my research skills. All of a sudden I found myself in the area of development. So I started doing fundraising. And I have a comrade here. That's good fundraising.
Best profession of all.
So I started doing political fundraising and managing events, and did that for Governor Levitt, and it was an amazing experience. And then in 2002, we hosted the Winter Games, and I got to be right in the thick of it, hosting VIP events for the governor. I remember working harder than I've ever worked in my life. I mean, at one point I tell the story where I called Governor, we were both, it was 2 o'clock in the morning, we were both working. It was probably like a couple weeks prior to the Olympics. And I made the mistake, I said goodbye to him. I said, goodbye, Mike, because I was so sleepy. And then I called him and apologized. I'm like, I can't believe I didn't call you Governor, I called you Mike. And he's like, it's okay, Governor. Like, everybody's tired, I don't care. We're all good. So anyway, so I had this cool experience, right, in the thick of things, and it was amazing. And then I burned out on politics. And so I worked, I'm trying to think of like the trajectory, like 5 or 6 years in politics probably. And I burned myself out. It was probably my own fault because I was working too much. So I decided I wanted to work in philanthropy in the nonprofit sector. So I got a job, I was the director of the Caring Foundation for Children, which is part of Blue Cross Blue Shield of Utah. And I raised money to provide free dental care for low-income kids in Utah and Idaho. And again, now I'm a grant writer. So I'm using all these amazing writing skills that I've received in the Department of History to be a good grant writer. And I did that for a while, and that was super fun. And then we kind of changed our philanthropy model at Blue Cross. We developed a corporate foundation called Cambia Health Foundation. And it's a corporate foundation based in Portland, Oregon. We have myriad companies that fall under this corporate name. And Blue Cross Blue Shield is just one of them. But we invest in projects in Utah, Idaho, Oregon, and Washington. I was a program officer, and now I'm the director of operations. So we get to invest in amazing work across our 4-state footprint. And I've gone from asking for money to investing money in others, which is a very fulfilling shift, I think, in my career. this is something, just because this is, and I need to wrap this up so I don't take Carrie's time. But this is something that's so important to me and something that we focus our investments on. I'm sure Marion is probably familiar with this. So we invest in work that impacts the lives of children, and many of you may not know, but there's something called the ACE study. And like a good history student, I have my citation at the bottom of the document. So you can go to the CTC and learn more about this. But we invest in projects that help decrease the impact of adverse childhood experiences in kids. So the data shows, and all the brain studies and science, brain science, saying that once the kids are abused and neglected, experiencing trauma, it has this lifelong impact on their health and wellness, to the point where they're more likely to, so it's like, it's basic things. Like I have an ACE score, so it's like divorce, abuse, a parent who's maybe an alcoholic, a parent who's been incarcerated. There are a number of things. But if a child experiences those things, they're much more likely to develop unhealthy behaviors in life, like addiction, obesity. But even beyond that, it changes your brain chemistry and your inflammatory system within you, and Marion would be much better to speak to this than me, to the point where you're more likely to have chronic disease state like cancer, lupus, heart disease, if you've been impacted by these things as a child. So the money that we are investing, some of the money that we're investing in, is to help get kids back on the right track. How can you build resilience in children, get them on a better path so that they're healthier and they're succeeding in class, they're succeeding in life, holding jobs, having healthy relationships. Very important research. And the other thing that we do, which I should definitely talk about, is we fund work in palliative and end-of-life care. That the majority of our funding is nationally in end-of-life care and palliative care for people who are experiencing serious illness.
Well, why is the Elements of Style the slide for end-of-life?
Because that's how I felt when I was reading. No, I did my slide too soon. So this is now, I'm switching gears to the things that I learned when I was at Utah State. So the thing that my humanities degree and my history degree, and I've said it, it taught me how to write and how to think and how to do research. Writing is so important, no matter what field you're in. And I can't tell you how much of my time is spent. I get so frustrated at work because people don't know how to write. And it doesn't matter if you're writing a good email, you're writing a memo to leadership, you're writing a grant, just your basic communication, you need to be able to write. And bless Ann Butler's, she's in heaven now with grace, heart for giving me C's and D's on papers, because she wanted me to learn and I learned it. And it's important. I think it's really important to learn the value of hard work. So much, I wasn't going to get into the millennial thing because I don't want to offend anybody. But I think there are all kinds of stereotypes about millennials thinking that they're just entitled to certain things, or not wanting to go through the blood, sweat, and tears that it takes to get from point A to point B. And I just want to reiterate the importance of working really, really hard to get to where Marion is, to where Carrie is, to where I am. Can't overstate it enough. Developing a work ethic and not just having an expectation that things are going to go your way, but working hard so you earn it. You need to earn it. I also think a lot of people in my life right now that are younger, that are in school, are really stressed to the max, like worried so much that you're not going to get a job. And I'm sure that's probably the case for many of you. I just think you just need to take a deep breath and know that things are going to be okay. And we're all perfect examples of that. The path may be meandering, but you will get to where you need to be. Don't be afraid to take chances and risks, and know that things are going to be okay. Just to really talk about a point, I know it's Year of the Woman at Utah State. All of the data shows that in Utah higher ed, institutions of higher ed, women are much less likely to graduate from college. They self-select into lower paying degrees. They aren't as likely to get a master's degree or a PhD. And I'm here to tell you for men and women, but for the women that are among you, you have got to get your degree and do not drop out of school. We all have children. We all have 2 children. We're just talking about the same ages, actually. I have worked my whole life. I have an amazing support system. I have 2 beautiful children, and you can do it. Don't drop out. because it has an economic impact, and you will end up impacting your family so dramatically if you don't have the means to support them and give them a good life. So please keep going. I know it's frustrating. I always had jobs. I worked like 2 or 3 jobs getting my education, but you have to keep going. Education is power. It's the best possible thing you can do for yourself. And with that, I will turn it over to Carrie.
Thank you, Marion and Kathleen. Awesome to get to know you and to find out that we have so much in common. This is incredible, and I hope you're listening to the themes that you're hearing about not only what brought us to Utah State and what we learned here, there are themes there, but also what we did with that and what we're doing with it today. So a little bit about my story. I don't even know how much time I have now, but it's all about our pathways, and I wanted to talk a little bit about my pathway and then some things that might help you along yours. So I came to Utah State on a tiny little scholarship because I went to high school in southeastern Idaho, and they sent me this glorious 300-mile radius scholarship, and I thought, that's it, I've made it. They want me. And it really wasn't that big of a deal, but I did come. And sometimes showing up is all about, it is the means to the end, right? So I showed up, I took this glorious tour of this beautiful campus, and I was sold. I got here, I did whatever it took to get here. And I remember the day that my mother drove me from Pocatello to Utah State, and as we drove in, I saw the lights, and I saw the temple, and I thought, this is it, this is the beginning of something really great, and I could feel it, right? Well, when I was here, not everything was great. It was hard. It was a lot of hard work. And I graduated. I got a Bachelor of Science degree, regardless of what the announcement says. I do not have a Bachelor of Arts, or if I do, I'm going to the office to get that printed out. But that is something really big, and it's big to me. It is very big to get your degree and to finish, and to realize that you are empowered and you can do something that is great and you have a lot to offer. And so that's how I felt. And in my experience here at Utah State, I did a lot of exploring. I'm going to kind of skip through these a little bit. So I was a USU graduate. I graduated in 2000. I was on the 5-year plan. That's what the 5 means, everybody. Okay, so my first experience here, we had the week of welcome, and we came to campus, and I decided I'm going to be a political science major. That was it. That's what I wanted to do. And I took my generals, and I went into this mass communications class, and I thought, okay, I like this. I like what we're talking about. I really feel good about this. And as we went further and deeper into this, back then it was a workbook. We got a workbook. And real books you had to check out from the Merrill Library. And I know I'm one of the younger ones here, but I still feel very behind in those days about the technology and things that we did not have. I did not have a cell phone. That might have been why I graduated. That might have been the key to making it. But I was in that class, and I just remember feeling like, this is it. This is what I want to do. And I always, as a child, kind of thought, I love to write. I really love telling a story, and I want to be a journalist. So that right then and there, changed my major. Went in, talked to Ted Keyes, who had been here for years and years, and said, this is what I want to do. I want to do the PR track. And they brought in teachers to teach us public relations. And it was awesome. So I graduated with an emphasis in PR. Tried to actually do a marketing minor, but I had a really great counselor who told me, what are you doing? Why are you seeking out credits in marketing when you're already over here on campus working a work-study job in the media relations and marketing office? You don't need a marketing minor if you're already working in an area that's giving you work experience. And that was some of the greatest advice I ever received, was just drop that idea and get going, move forward. And so I did, and like, again, good people all along the way. So I think some of my advice would be, as students or as advisors, just surrounding yourself with people like that can be a sounding board and give you some advice when you need it from someone who maybe doesn't know you as well. After college, though, when after graduation, so I had worked on campus at the Media Relations and Marketing Office, now Public Relations and Marketing. I went right into a job at the Herald Journal. I was already working there. I was called the webmaster back when they had webmasters. And to be a woman webmaster even in a small newspaper was something very unique. And I had some interesting conversations with people about that, and what they didn't know about the internet. So I loved it there, though. I loved that, and that brought me back into the idea of storytelling, and I got to see and witness the newsprint come off the press every day. I mean, we had a press right in the building, and I could smell it, and I could watch the news and listen to the news and see what was coming across the Associated Press line. And I worked myself into a copy editing job, and I decided, I really like the visual arts aspect of journalism. I love the layout and design piece of that. So as a copy editor, I got to work with the front page, and I got to decide what went on the front page and what went on the local pages. And even in a small community such as Logan, those were some of my best and finest work memories of all time. And, excuse me, really good mentors all along the way, even in crusty bosses, okay? Those will be some of your best memories as well. So I worked for some newspapers. Then I married the love of my life, who I met here at the Spectrum at a basketball game, of all places. And we decided we're going to Boise. We're going to follow this job to Boise, and so I said, okay, I'll just call up our sister newspaper and I'll go work for them. I'll be a copy editor there. And that's what I did. Things just kind of fall into place, and so I did that and realized I hated it. I hated it. I went into work at, let's see, what was it, 1 o'clock in the afternoon, and I left at about midnight every day, and I hardly ever got to see my husband. We would just kind of cross in the night, and it was okay when we were newlyweds, and it wasn't that bad, but I learned some great lessons, and I learned what types of environments I didn't want to be in, and so I sought out some public relations jobs. I said, forget this. Journalism isn't going to pay me anything, and I'm worth a whole lot more than that. And so I looked up this job in a newspaper. They didn't have Glassdoor or whatever we have now. And I found this job at Cigna Healthcare being a public relations representative. And so I traveled 17 states, 2 weeks a month out of a season, and put on these seminars for durable medical equipment suppliers, and I taught them how to bill to Medicare and what they could and couldn't do, and I learned a lot about healthcare, a lot more than I wanted to, and it was good until we realized, you know what, we need to get back to Utah State. Cornell, my husband, has got to finish his undergraduate degree, and so we hightailed it back here, and I called up the Herald Journal and said, I'm coming back. And they were like, okay, we'll figure out something. And that was awesome. And so I made it back to Logan, love this place dearly. And then I found this company called Spillman Technologies. And I remember when I was here on campus, they had told me when I was an undergraduate, the two biggest industries that you will find a job in will be healthcare and high tech. And I remember that so vividly. And then when it actually happened, I thought, I guess you gotta listen a little bit sometimes. And things actually sometimes do come to fruition. So I was working at Spillman Technologies doing marketing and communications and a variety of writing, and found myself into this software engineering company and trying to write for all of their communications. Did that for 6 years, and that led me into a position actually at the insurance end at Intermountain Healthcare, working at Select Health. Some of you, well, raise your hands. How many of you are aware of who Select Health is? Maybe a lot of you actually have Select Health. And so now that has brought me to Intermountain Healthcare, which is our central headquarters. And let me just click through here. So this is our Intermountain Medical Center here in Murray, and our flagship hospital. Part of what we do, and this is again some of the themes that we've talked about, but it's really all boiled down to helping people live the healthiest lives possible. I think that we can all get behind that. That's something that I think we all strive to do. And living healthy comes in so many different ranges. But part of Intermountain Healthcare's footprint, in case for those of you who are not familiar with Intermountain, but this is the footprint. You can see from those dots, we have 24 hospitals. One of those is a virtual hospital or a telehealth connect care, virtual care. And of those hospitals, it's comprised of 2,900 hospital beds. We have over 200 physician clinics throughout the region. And our employees or our caregivers make up 40,000 plus employees, which is the largest employer in the state of Utah. And I'm one of those, and I'm proud to say that I am a caregiver. I'm not a doctor. I wish I was a doctor like Marion. But I work, it's interesting, I work with doctors every day, and like Marion said, well, this is kind of by the numbers, but I'm gonna go through this quickly. And you can look back on this later, but something that really stood out to me about what Marion had said, it was just this last week that I was working on a presentation with some of our medical directors, and we're talking about physician engagement. How can we help physicians not burn out? How can we help them stay engaged? How can we ensure that they're providing the most high quality healthcare in the safest environment? And the one word that came up, and the one word that we're focusing on is humanity. Humanity. And we've got to get back to that core of caring about people is a human action, it is a human desire, and something that is embedded in all of us. And so if you can take a humanities degree and take it and go somewhere, you can go anywhere with humanity, right? So I love that. And if I can impart anything, and I'm probably the last person who should give someone any advice, but the pathway skills that I have learned and that I would suggest others to develop are resiliency and grit. This comes from a story that a colleague of mine told me just yesterday. Our CEO, Mark Harrison of Intermountain Healthcare, was actually rounding with some individuals in Utah County earlier in October, and a community member had asked him, how do you select people to work with you? I mean, those that you actually work with on your executive team. What are you looking for? And of course, everybody, went like this. And he said grit, and I wholeheartedly agree. This is something I learned at Utah State, trying out all kinds of things and failing sometimes. I had to redo economics twice. But when I failed, I turned around and I moved on. Developing those skills of resiliency and just the willingness to find what motivates you and stick with it I think is key to anyone's success. Fostering diversity, not just embracing it, but actually fostering it, making sure that everyone is heard at the table. And you talked about this too, Kathleen, not just women and men, but people of all backgrounds, people of different ages, people who you maybe just don't know as well, you want them at your table too. Having all those voices heard and being able to foster that and seek those out will make you successful. Taking chances and experimenting. Sometimes it is about taking a risk, trying something different or something you normally wouldn't do, and seeing where that takes you, and adding that to your belt. And then, of all the things I learned in communications, I do love the things I learned about writing. That is essential. But it really was embedded in some of the journalism tactics that I learned, and it's really all about asking questions and then learning how to listen. I feel has been the biggest key in my career, and Marion, you echoed this as well, and really being able to ask a patient a question and then listen and find out what they're telling you is part of that research process, and that can be applied in anything, in any career, in any area of your life. So these are my 4 takeaways, if you had any pillars to take away. So I appreciate your time, and the invitation to be here is so special to meet with all of you. And I do just want to tell you that I did leave my mark here at Utah State. It's physically visible. No, one year when I was working here at Media Relations, they were redoing the sidewalks, and as I walked up this morning from the terrace parking lot, I noticed that my initials and the date are still in the sidewalk. So that was very special, and I really want the notice on when those sidewalks are going to be redone so I can go back out and make my mark again. So thank you all. Appreciate it.
So we would welcome any questions any of you have for the panel.
Any questions?
While some of our students and attendees are working up the nerve, it's just a question about, since you guys touched on the idea of how possible and even how rewarding it can be to have a family and have children, even as you move up in your careers, and this sort of disconnect between what we perceive as a career that's appropriate for someone with a family and someone we don't. Can you speak to whether or not that has been a difficult disconnect to even overcome in your workplace? And I'm coming to this from a place where my sister is a physician, and she's in a particular field where she also was the only woman in her class, and she's a partner, and she works in a practice where she works very hard. And I think sometimes there's that, you want to make sure that people don't perceive you as using your family as an excuse, but she also feels like she's working very hard to achieve that work-life balance. And I just wondered if you guys could elaborate a bit more on that, since you brought it up.
Who wants to take it? I think certainly I've experienced that in my own career, right? I don't think that will ever go away, trying to make your work and your life balance, whether you have children or not. But certainly having a family presents challenges, right? I don't know that humans were ever meant to work 9 to 5, but we do it. But I think it's part of the creative process and speaking up and having a voice to be able to say, this is what I need and this is what I'm willing to give, and expecting a certain environment of care from your employer so that you can have just that balance or that human aspect in your own work. But I do have an experience where working for a specific company where I had to make a choice between having a flexible schedule, being able to raise my children, or staying with that company. And I chose to leave and find other people who embraced that lifestyle and were able to offer that flexibility. So I think you just have choices, and you have to be willing to do what's right for you.
I think finding somebody who's supportive, and Marion has great insight into this, but finding somebody who's supportive. I mean, I have an amazing female boss right now that's also a working mother, and that has made, I mean, she's really tough, but she's very good to, you know, if I need to leave to take my kid to a dental appointment or whatever, it's no questions asked. And I foster that same sense of flexibility with the employees that work for me. It's really, really important that they know that family comes first, and you need to, if you need to be with a child or with a partner or whatever, you need to do that. I also think, to Marion's good point, you work really, really hard to attain as high a level as you can, so that you then have the flexibility to have some of those choices. Does that make sense? I mean, I have a great deal of flexibility in my job, but it's because I've worked my tail off to try and get to a level within the company where I can make some of those decisions. So, and you do have to have, I think, a supportive boss, supportive company culture, and I have a great husband. I have my mom's here. I have a lot of support people around me that help me with my kids. I mean, if I need to fly somewhere, I know I have a backup plan in place to help me. So it doesn't happen in isolation. It's not just me. I have a whole team of people who help me. It's really important.
Yeah, it's fun to be here and to hear other people's stories. But a couple of things, like someone said to me when I started this process, they said, you know, you may really enjoy being the boss. And I was like, but it's completely true. You want to, and being the boss can mean a lot of things for different people, but you want to have as much power and as much autonomy within the workforce as you possibly can. And sometimes that means that you may have to scramble. A lot of physicians in my generation, and I'm thinking about your sister, like, we earned our stripes by working harder than the men, and by never saying no, and by never being late, and by never and in some ways I'm incredibly proud of myself for that. And in other ways, it like probably took years off my life, and I'm not joking. There's data based on overwork, shift work and longevity, like it just like starts coming down. And so, like, I'm in a transition, and I've worked with men who are very sexist, and I've worked with men who are terrific. And the current group that I'm in, like, couldn't be more supportive. They're all raising families. We just kind of see each other as being in this together, and we're trying to help each other. I was going to say two things. One is a story. When I finally got a female partner, one of the first days that I worked with her, she had had a baby right before she came to work for us. And when you come to change of shift, like in an emergency room, like the emergency room never stops, right? So you try and tidy up a little bit, and the new physician starts seeing patients, but like there's overlap. Like people that, like, they're not quite through and you don't know what's gonna happen, and so you pass those on to the next physician. And probably my second time working with her, we met like in kind of a little room off the ER to give that transition, and she was pumping breast milk to feed her baby, and it almost made me weep, because this woman is phenomenal, and like just to like see that embodied in such a way was powerful and profound. I also think that each of you, both the men here and the women here, can be a part of changing culture. As I started to work, realized that the strategy of working myself to death was going to kill me, and started to cut back. I made some really conscious choices about other things. I frequently take my children to work with me, and I don't ask for permission. I have held my baby and run a trauma resuscitation. My daughter says, "What's your Christmas?" In school they talk about Christmas traditions, and she says, "My mom always works on Christmas Eve, and I go with her." And I'm actually incredibly proud of that, because she learns about service. She learned, like, that's what the holiday is about. There are thousands of people in this country who don't get a Christmas tree and presents, and how can we serve them on that day? And the other thing is that I make an effort. Like, I teach Sunday school in my church, and I don't necessarily. I made a decision when I did that I was not going to not talk about my job. that that I don't go out of my way to look for examples, but if there's an example that's germane, I don't hold back. And more men and women need to do that. We need to, we kind of need to normalize all these things. Like, so there are 1,000 solutions to your sister's problem. And, you know, they're all talking about some, and it's a problem that we all have to tackle together as people who love our partners and as people who love children. And as people who want to make the world a better place. Because the more voices that are at the top, the more diversity of voices, like the better it is, right?
And I don't think there's one perfect balance. I mean, people talk about work-life balance, and this is for men and women. Sometimes I am crazy into my job, and I'm gone a lot, and it's hard on my kids. Sometimes it's slower, and I am at every possible function I can be at with my kids. So there's sort of, and it's this constant juggle. You know, I'll be like, Mom, I've got to go to Portland next week. I need your help. I mean, it's this constant. It's a juggling thing, but you just have to multitask and do the best that you can. It's not a perfect thing, but just do the best you can.
And I think, sorry, I can get on my soapbox.
I know this is a good one.
No, but I think it's important for kids to see parents working. You know, that men's and women's voices are equally important for the betterment of our world. And what's more, that's a privileged thing for me even to be able to say. There are men and women in all kinds of circumstances who work their tail ends off every day simply because they have to. And if those of us who have a voice and have an opportunity to put it into a large corporation or a big hospital system can like speak for ourselves, we're also fighting for other people.
And it's okay to tell them it's not just because we want to pay the mortgage and heat the house, but we like it too. That's okay. No
kidding. Amen. Yeah. Like, I love to work. I love my job. And that's, you know what? Right on.
And heaven forbid, you know, all those kids would have gone without health care and whatever else. Like, were you not working? Like, heaven forbid.
I have a question. I work with a lot of students that are graduating, and like getting that first job, or even people that are in a job they don't like and they want to get another job. How do you guys have been successful, but I know you've had those situations where you're trying to get a job, and I know when I went through that at different times in my life, that can be very demeaning when you're trying to put yourself on a resume and get a job. So any suggestions that I can tell these young students that ask me, how do I get my first job? I'm kind of like, what are some suggestions?
With a bachelor's degree and then a master's degree in English, I sold sporting equipment at a sporting shop in Manhattan. I did temporary work on Wall Street. I think you just can't be proud. And eventually you build a resume, and then I taught too many courses of English 1010 to count, which is a wonderful job but not a prestigious one. You know, I think that idea that you're going to land the plum job out of college sometimes happens for folks, but the rest of us scramble. And that doesn't mean you're doing anything wrong. That means you're doing something right. Like, you're in the fight, man.
Yeah.
You know?
Right. And you want those things. You want to experience those things. But I would say just make a connection. It's great to have your resume ready, and it's great to get into career services. They have so much to offer. At least they did for me. I don't know if it's even still called career services.
It is. Yes. Career services is still
okay,
available.
right.
So,
It's career services.
yeah.
But for me, it was my work study job. It was knowing someone who knew someone, and I didn't really know them that well, but we made that connection, and I learned some interview skills that helped me nail some jobs. That's always a good thing to prepare yourself with. Mm-hmm.
And I think LinkedIn, like my nephew Jack, who is like, "Are you on LinkedIn?" I'm like, "No." So, but now I am. Make sure that you're staying, keeping things current, keeping your networks up, and it's all. I mean, for me, it was a lot. It was hard work, doing whatever it took to be good at my job, and then and just people that I knew. And I did an internship. That internship that I did with Poli Sci was key, because then I got there, and then they knew I was a hard worker, and that stayed with me the whole time. They're like, yeah, hire Kathleen because she will do the job and be good at it. And so, like internships, anything you can take advantage of within Utah State. Promote yourself, and don't be shy. Like, promote
Be
yourself.
confident.
Like,
Yeah, you have. It's like having a whole deck of cards, right? You've got to be willing to deal some out there, and you have nothing to lose. You've got to get them all out there before you can find the ones that are going to be part of a winning hand. So you've got to be willing to get out there. Anyone else? I kind of want to learn about your stories, but.
Well, I just want to thank the three of you so much. This has been better than I could have even hoped for. Just the way that your stories have lined up, the fact that several of you figured out that you know common people. I mean, I just think it's sort of, it demonstrates that Utah State is not just a nice foundation for what you learned here, but also a community. And I appreciate your willingness to come back to this community and get back to it and speak to our audience today and just tell them a bit about your experience. And not just the audience today, but Simon, of course, is making it possible, hopefully, for others to hear what you guys said, because I found it incredibly touching, and I hope that others will too. So, thank you so much.
Thank you.